It's, of course, Health Tuesday, and my favorite eye doctor, my favorite optometrist is here, Dr. Sharon Enemo. Now, today we're talking about common eye disorders in the elderly.
Yep.
Okay, first of all, what is it? Who is elderly? What age do you think elderly starts from? Because there's some people here, they call themselves elder. And,
Well, to be honest, 50 and above.
50 and above.
You could even say 40 for some persons.
40?
Yeah, not
So
because,
Marcel is an elder.
not because they say 40 is the new 20, but the bottom line is 50, 55 and above. Yeah,
Okay, all right, I understand what you're saying now. And by that time, I mean, you start, with majority of people, I mean, the eye maybe starts deteriorating, as it were, and all of that. It's kind of, like I said, it's natural at times. It does happen. How does there, well, care of eye can make it, stay long and all that, but what are the most common disorders that we get to see as one approaches that age?
Like you said earlier, when we get older, the whole body begins to get old as well. Yeah, so there are certain disorders that actually begins from 40, but it trends up until the end of life. Presbyopia, that's need for reading glasses, is a disorder that you only see in the elderly. Basically, from 40 and above, you begin to have that. Then there are certain conditions as well that if one has systemically, like diabetes, there are complications of diabetes you find in the eye. Diabetic retinopathies, you find it at the retina and could lead to vision loss if you don't care for your diabetes very well, and leads to that complication in the eye. So you could also have retinal detachment. These are all disorders you can find. Macular degeneration, age-related macular degeneration. So now, to give a background for someone who doesn't have science, there's a part of the eye called the retina.
Okay.
It has almost all the cells the eye needs to see. It's located in the retina.
In the retina.
That is the powerhouse of the eyes. Now, when you begin to have degenerations in that part, which can occur due to poor systemic health through life, and then as we get older, continuation of that health, the poor health that stems and flows into the eye, you now begin to have the disorders I talked about.
Okay.
So you could have glaucoma as well. There could be cataracts. This one is on the lens. These are orders.
Different parts of the eye.
Different parts, different layers of the eye.
Are there any can one be predisposed due to family medical history when it comes to the eyesight? Maybe if your father or your mother maybe used glasses or had this thing. Does it, like in some other cases with the health, does it trickle down to offspring?
Yes, there are certain conditions that are hereditary. That's what you're asking.
Yes, exactly.
People that come from homes where there is diabetes tend to have a likelihood of it going into their children, particularly when those children also live lives that are not, I don't want to use reckless, but they're not very healthy.
Very healthy.
There's a greater possibility that they will have.
But is there anyone that's specifically just with the eyes?
Short-sightedness.
Okay, so it can.
Yes.
It can be hereditary.
It can be hereditary. So yes, if your parent have it, if a parent has it, there's a 20% chance the children will have. If two parents have it, you're almost looking at almost 70% chance.
Is there anything the parents can do? Let's say
you're short-sighted.
Is there anything they can do? No, I mean for their offspring, like from when the kid starts up, so in such a way as to prepare the kid for a better life, as it were. Is there anything that can be done?
For things like myopia that we talked about,
yeah.
Now we're deviating from the elderly,
okay,
right?
Yeah. Well, elder, yeah.
Yes. For things like myopia, you really can't. It's a physiologic thing. It's the way the eye is shaped, A parent has a kind of, like the genes you're passing on, this is the way you are. Your wife gene is this way. When you cross together, it mixes and then produces a beautiful...
Then it gets worse with age.
Yes, myopia doesn't necessarily get worse with age.
Okay,
remember,
that's what I was going to.
Myopia doesn't get worse with age, but there are certain myopia that are degenerative. You can find out even a child that is as young as 7, 8, they have degenerative myopia.
Myopia,
yes.
Okay.
But then, if an adult that already has it, as you get older, there are likelihoods that, yes, you could have things like the retinal tear detachment we talked about. Understand that retinal detachment is a big deal because the retina has layers, the inner and outer layer that are supposed to be stuck together to enable impulses, visual impulses go to the brain. When there is a separation, you see there is a gap, a bridge. So impulses that should go to the brain for interpretation, for you to have good vision, is no longer there. Likelihood of vision loss, of course. And that's why we always advocate for once a year eye examination.
I saw this video about a few months ago. I think he's the most followed personality on YouTube. He calls himself Mr. Beast. And he had this eye operation for about over 1,000 people. And most of them were elderly. And a lot of them recovered their sight.
That's what I said.
You know.
Once a year, at least once a year.
But it was some sort of an operation or something and
yes,
all of
there
that.
are surgeries that can be done. Numerous surgeries are done. Even for this retinal detachment, there's a surgery, but you have to catch it on time. You see, these things are, when you go for that eye exam on time, you find it on time, then you can have your vision restored as much as possible on time. But when you it will go away. My village people are after me. It's not normal. Or you just ignore. It deteriorates. And then by the time you finally find yourself into the clinic and then into the surgical center,
it's gone. Now, I know we've mentioned this before, but for the sake of those who maybe were not there on the previous episode, let's talk about some of these symptoms that people ignore that they should watch out for so that they can go, or as they grow older, so that they can go check their eyes.
For the elderly, it's important when you can't see distinct images. Sometimes we hear our grandmother say, okay, someone is coming. I know the person by voice. I really didn't see the face. That's the challenge. It is macular degeneration, because there's a part of the retina that is the macula that gives us precise vision. Once you begin to see shadows, you are looking at a table, for example, and one part of the table is gone. As in there's a shadow, but you see the other part, please go see your doctor. When you begin to notice you're looking at someone, the face isn't very close, except they come to a certain distance. It is a problem. Go see your doctor. When you begin to have eye pains, some will tell you, oh, it's pain. We know how to bear things in this part of the world.
We do.
We know how to bear pain because we are like, okay, I don't want to go to the hospital and spend money we used to eat. Forgetting that your eye is important. If you don't have eyes, you won't even have economic value to be able to find what you will eat.
That's why when you talk about operations today, I'm already...
Look, there are people that are trained for this thing, and they are good at it. So the earlier those things, the advantage is taken when you have issues and you need to have a surgery, do it quickly and get your vision back quickly. People have cataracts and they have what we call preventable blindness, but preventable because all they need is a surgery and they can get their eyes back if other things in the eye are good.
Okay.
But some will go with it 5, 10 years because they don't know they should see a doctor. Let me give them benefit of doubt. Or they know they are looking at the economic implications, or they think it will go away. We give ourselves reason to just keep tarrying along, and the eyes degenerate as we tarry along.
Wow, thank you so much, Doctor. It's always an expose talking to you, and yes, I'll trust you with my eyes. I will definitely check.
Please.
All right, thank you very much.
Thank you. It's always a pleasure to be here.
All right.